Whenever we listen to the word cancer, there is a lot of grief and a lot of trauma associated with this subject. Mainly because cancer is directly associated with death, and there is not much awareness about this subject. And when a person sinks into negative thoughts or constant trauma and grief, it takes a toll on the person, not just physically, but he's also affected mentally. And because of this, probably there could be adverse effects on his cancer treatment. And here I'm not just talking about cancer, but also other terminal and acute illnesses that a patient might undergo. I thought this to be a very important subject, which needs to be addressed, and that is why today's episode is dedicated to this topic. To discuss this subject, I have with me today Dr. Prutha Patel, who is a medicine oncologist who is working with Zydus Hospital in Baroda. I'm sure that this episode would be an eye opener for our listeners. Uh, Post in your comments, your questions in the comment section after listening to this episode, if you have any, and we will try to find an answer to all your questions through reliable resources. Please share this episode with all the people who you think might find it useful. Enjoy the episode. Hello, Dr. Prutha Patel. I'm so happy to have you for this recording and for this particular episode. And when I was thinking about this topic of talking about the mental health care support for the cancer patients or for people who are undergoing similar treatments, I could think of no better person than you. So thank you so much for joining
Thank you.
in.
Thank you so much, Nazin. It's nice to be a part of this.
So, Dr. Prutha, according to your experience, um, whenever you hear or whenever you see your patients when they get to know that they have been diagnosed with cancer, how what is their first response? What is the response of the patients, and how do their family members react to listening to this news?
Ah, uh, Cancer. As soon as patients hear the word cancer, it's like the time stops. There are so many emotions, right? From shock to denial and even fear. Majorly, it is fear. Just not of the illness, but how it will affect their future, how it will affect their relationships. And somehow, patient just, they just tend to think of the worst case scenario. Despite of so much advancements and so many sophisticated treatments that have come up, cancer still is associated with a like death sentence. So this is the major. It is a major shock, and patients do take a lot of time to process it.
Yeah, okay. And according to our daily experiences, also when we know that usually we undergo a lot of stress, we keep on thinking about certain things or certain negative stuff that is going on in our life. If it affects our not just the mind but also physically, it affects us. But when someone hears the word cancer, he or she undergoes, a chronic stress. Constantly, he is under grief and fear. So, how do you think that this is affecting the person during his treatment, and how is the treatment affected when a person is constantly thinking about death and fear? And how does it manifest in his or her daily life?
It does take a toll, and it is not an easy diagnosis of to understand. So, consciously and subconsciously, it affects the routine. Uh, and patients do tend to get a bit depressed as well. So it takes a lot of support from the doctor, support from the family for the patient to come to term with uh, this illness and to understand that it is curable if diagnosed early. So it's a mix of so many emotions, as I mentioned. But now slowly and steadily, patients are accepting that this is a very common illness that we encounter, and it is better than what it used to be initially. But it does take a toll.
How do you, as a doctor, how do you recommend managing these emotional turmoils, these emotional griefs that your patients and the caregivers undergo? What do you, as a doctor, suggest to them that they should do to manage the situation?
So one simple instruction which I give is that follow your routine. So it could be something as small as just having their cup of tea in the morning, or journaling. So obviously it is there will be a change in the routine, but as long as you stick to your routine and you keep doing what you're doing without this affecting much, and somewhere you do need to set some realistic goals as well. Exercising is one thing. I always emphasize on rehabilitation, because it helps you it keeps your mind healthy. So as long as your mind is healthy, your willpower improves, and you do tend to get little motivated to continue the treatment. Secondly, I always explain what to endure, that before starting the treatment or before going ahead this road, I tell them that, see, this is what all we will be facing along the way. So they are sort of mentally prepared. So when the complications or the side effects happen, it doesn't come across as a shock. And the caregivers are sort of, they are burning their candle both sides. Caregivers, I feel we tend to neglect the caregivers, and they somehow feel that they cannot show any emotion to the patient. But the support system should be strong, and that is the main thing that helps along the journey.
Yeah. And how can it be strong? So, um, mentally, what all, is there some help available while maybe if someone visits you as a doctor or around in the hospital, or maybe there are certain groups that could help out the caregivers as well as the patients, because everyone has everyone does not have similar strength. Some of your patients may be very cool about the treatment, and they would have a better endurance, but not all the patients or not all the caregivers are the same. So how is it managed?
Uh, Family plays the major role. Uh, Secondly, we do have support groups available. So, my uh, existing patients, or the older patients whom we call cancer warriors or survivors, they have sort of formed a group, and because those are the people who get it actually, and when you talk to them, it could be it is quite different to what you or I might tell a patient. Secondly, online help is available. There are certain websites, like there is Cancer Cure organization. In India, Tata Memorial does have some uh, groups available. So WhatsApp groups are there, online groups are there, video rooms are there, where they do have regular meetings. It's just like Narcotics Anonymous or Alcoholics Anonymous. It is similar to that, but cancer survivor groups. Secondly, reading materials are always there. So magazines, and I sometimes do recommend certain books that they can read. Some what to say, just willpower building books, and psycho-oncology. Psycho-oncology plays a major role. So majority of the cancer centers, they do have an affiliated psycho-oncologist. We do have one at our hospital. So when I see that somebody is having a difficult time accepting the situation, or if I see signs of depression creeping in, then I do advise that they seek some professional help for it. Not just the patient, the caregivers too. So there, and nowadays multiple sources are available and it is well taken care of.
Correct. So you talked about psycho-oncologist, right? So is it like a therapy or is it like a communication? And if you have ever witnessed a session between the psycho-oncologist and your patients, and you could just, get to me into that session and what happens there, if we can just get to know a little more on it.
So majority of the times it is private and they are basically counselors, but the depression which is related to cancer, it is different from, I would not say very different, but it is different and they need to be counseled or they need to be handled in a certain way. So they just, apart from conversations, there are certain exercises for mindfulness, and they do recommend journaling, that you pour your thoughts in a notebook, or whenever you are angry or you are depressed, you just jot it down, you clear your mind, you rant on the book. So, or you can take voice notes. That is what they recommend. That if you are having too much, if your thoughts need some detangling, then that is, you may write it down, or you can just speak, record. And when you are actually feeling motivated, at that time also you can sort of record it down, which you can hear when you are feeling low ahead. And sometimes, if you are feeling grateful for anything, or if you're feeling hopeful, those are the moments when you should, you should write those down also, or you can record it down.
Mm.
There is no fixed amount of sessions that are required. It is, and some patients, they do not need it. Uh, but when I see that you cannot go through the day without thinking of death, or without having negative thoughts, that is when they do need help. And as a doctor, I have to look for the signs, because patients still today, they do consider psychiatry as something negative. They associate it with another illness. So they don't really come forward, but you do observe signs here and there. Sometimes the caregivers come and tell that ऐसा हो रहा है, खाना पीना छोड़ दिया है, बात नहीं करते हैं, या सोते रहते हैं, या गुमसुम से रहते हैं, otherwise who were normal. So that is when you.
Is there some help in terms of therapy available for the caregivers as well in the hospital, or do you recommend them as well to go for a therapy session maybe elsewhere? How it works for them?
So that's a very important point actually, because uh, I say you cannot pour from an empty cup. So caregivers are the support system. They are a lifeline, and they, most of the times, they do feel guilty about uh, uh, expressing their fatigue,
Yeah.
because when you are taking full-time care of an individual, it takes a toll on your mental health as well. But they never come up with these. It never even comes in the conversations. So there are support groups for caregivers as well.
Yeah.
And what we do is that whenever any of my patients are admitted, we usually have daycare chemotherapies. So they are admitted in the daycare, wherein the patient is there, and along with the patient, one or two caregivers are present as well. So what I recommend, and which is easy, is that they can sort of communicate amongst themselves. So while they are waiting for their loved one to complete the treatment, they sort of form a group. They can have some discussion over tea or along with snacks, and कि हम ऐसे कर रहे हैं, this is how we are dealing with the issues. So that way, one support chain has been formed. Secondly, not many official programs are there for the caregivers, but uh, uh, when I send my patients for counseling, if I feel that the caregiver requires counseling too, I do convey that to the counselor, and they try to accommodate that along with the patient. Most of those sessions are together, like along with the patient, because they do not come and tell you because they don't want the patient to feel like a burden.
Hmm.
It is so, but it is there, it is real, and it is taken care of little subtly, but it is taken care of nowadays. Actually, it is required that they take a break. So,
Hmm.
switching of caregivers is also one way that helps them.
Yeah.
Now, for example, if a patient is living with the son, is their son, so the son or the husband is the primary caregiver. So, I do recommend that they can sort of switch the duties once in a while. They that also helps.
Okay, yeah, perfect. But now that brings me to another aspect of this. You, as a doctor, day in, day out, are seeing patients who are undergoing a lot of trauma, right? And I think that it somewhere will be affecting you also as a doctor, as like, because then you have a family at home, and then you are on the job for a very, very long time. So how do you deal with the situation, and what is like your draining off routine? How do you take care of yourself? How is the switching off happening with you?
So probably you're amongst the few people who have asked me this question because it is sort of assumed that doctors do not, it is their job, and so uh,
Yeah.
this doesn't happen. But while I was doing my residency, I did a little research on this topic. There is something which is known as the burnout syndrome, and it is a very real thing which is happening amongst doctors. Oncologists top the
Okay.
uh, sort of chart because our field is supposed to be the most sort of wherein we deal with majority of the terminally ill patients. So what was and While I was doing the research, we also tried to find out how we can uh, uh, solve it or how we can combat it. Uh, it was just decided, sorry, it was the main conclusions were the few good recommendations were to separate work and uh, personal life, obviously. So, like, we do not recommend online sessions from home. So it's fixed hours of professional practice, and then once you're home, you sort of uh,
Be at home.
separate it
Yeah.
out.
Yeah.
Secondly, exercising again. So because it is a tedious job, most of the times your personal well-being or your physical well-being is sort of compromised. So take those 20-30 minutes uh, of the day for yourself, wherein any yoga, meditation, something which just clears your mind. Be grateful for the good things that you have in life. Discuss with your colleagues if you have any issues. And secondly, fortunately, there are so many advances coming up in oncology that majority of the cancers are sort of now curable. So that again is giving hope. It is not as bad it used to be initially. कि पहले it was like कि cancer है तो it is a death sentence कि patient is going to go. And these are all chronic illnesses. So you do form a bond with your patient. So when you lose that patient, you are affected just as much as the caregiver is. Maybe uh, maybe not as much, but quite a lot. So just being mentally strong, that will help you deal with all these and the long duty hours. So just some mental wellness and separating. personal and professional. So you just need a proper boundary. That is all that helps actually.
Okay. If I may ask one more question related to this, when you say defining boundaries and working for fixed hours, so does it make you like used to seeing what you have been seeing as a doctor, and then you're kind of okay with what is happening? Or you said that it affects you a lot, but as an oncologist, maybe you have seen deaths, you've seen losing your patients. So somewhere down the line, you get used to it, or okay, this happens. Is it so, or how is it?
Uh, so now when a patient first comes to me, at that point of time, I do know that what the stage is or what the prognosis is. If the prognosis is good, I am sort of mentally prepared that this patient will be fine. Now, if something unforeseen happens in such a patient, it gets it does get sad for us too. But if the patient were a terminal patient to begin with, or if the prognosis was dismal right from the beginning, you are sort of mentally prepared.
Yeah.
The relatives or the caregivers might not be, but you as a doctor, you do have that clear mind that, see, this is how it will go down and this is how it is going to eventually end. So, in those patients, I do not really feel as depressed because I am I am realistic in those patients. And the first scenario which I mentioned, that is quite rare.
Hmm.
So that is how it is for me. I am used to it, you may say, but if it happens suddenly or if it happens unexpectedly, that is when uh, you do feel that loss.
And how do you bounce back from that loss?
So you never really completely forget it. Somewhere, someday it does pop in, or if you see a similar patient or if you see a similar case, you do get flashes of that patient or that scene. But if you have done everything that you could have done at that point of time,
Hmm.
or if you were not uh, uh, unethical, or if it, then you have to just accept it as God's will. And I try not to get guilt about it because you are eventually human, and humans do make mistakes once in a while. So after so many years, when I was in my med school or when I was in residency, at those times, those losses, I do still get flashes of those. But now we do understand कि चलो 99% सब जैसा सोचा है वैसा चलेगा, but 1% तो थोड़ा बहुत it is going to be there. So acceptance and just having those realistic goals. You cannot hope कि each and every patient of yours will have a miraculous recovery. That is not possible. So that is how I cope.
Yeah. So I have personally seen a lot of uh, cancer warriors, you can say, in my own family, like in close
Mhm.
relatives, right?
Right, right,
And
right.
many of them have had like a very long battle, and they
Hmm.
couldn't survive.
Right, right, right.
And during that time, I myself, it's just the hope and prayers that we
Hmm.
know, because we are not professionals and the doctors are doing
Hmm.
their bit. Um, Now I have seen a few of my cousins who were undergoing this, and they totally gave up on the treatment, even if it was recommended by the doctor. They totally gave up the treatment because they thought that the pain of the treatment itself was too hard for them to see. So they thought it's better that this person goes peacefully rather than undergoing so much pain. So when I talk about pain, I mean chemotherapy, and I mean radiation therapy. So I think that it is something that I have seen, and also have heard in other patients, that it's a very painful process, that a patient, cancer patient particularly undergoes. So I would want you to talk a little about it, and how can patients not give up, and how can they endure that treatment, so that they can move forward and have win this battle for life.
So, what you just mentioned, this is what I hear in say about 80% of my OPD. Because when a patient first hears that they've been diagnosed with cancer, the next thing they do is go and ask multiple other people, or without asking, multiple other people will weigh in their opinions. Google is always there. So, I will tell you what I tell them, that no two patients are same and no two treatments are same. The treatment depends a lot on the initial stage. If the initial and the type of the cancer. So now there are some cancers which we call good cancers. Like no cancer is good, but by good cancers I mean that they have good prognosis and the treatment is not as toxic. Very few are the bad cancers. So uh, the commoner cancers are usually the good cancers, uh, and stage. So now, if it is in the early stages, that is first, second stage, most of the cancers are completely curable, and the treatment side effects are just temporary. Nothing is something which will stay on for life. Maybe after those 6 months or a year, you will just treat it as a forgotten chapter in your life, and you can move ahead after that. So you need to be aware, or your doctor needs to make you aware what to expect, like where you are standing, and this needs to be decided from the very beginning. What we follow is something known as a tumor board discussion. That is, when we have any new patient, we we sit together. That is the surgeon, the physician, the radiation oncologist, the palliative care physician, and we decide a plan ki how to go about it. The painful procedures that you mentioned. So now chemotherapy is not really painful if it is administered properly. If it burns the vein, it is usually like it is an injection which is given through your veins, and if that is administered properly, it is not painful. The side effects do not come until maybe 2 or 3 days after the administration of the chemotherapy. Majority of the side effects are common, like vomiting or fatigue or nausea or decreased appetite. Hair loss is an important side effect, but all these side effects are completely reversible and they are temporary. So most of my cycles are placed, say, 14 or 21 days apart, and patients feel these side effects just for a week or 10 days, and after that, they are good to go. The other thing which you mentioned is that if a patient is sort of terminally ill, would I still recommend a certain level of aggressive treatment? So the answer is no. Sometimes what happens that it is an early stage cancer or it is a cancer with a good prognosis who have unfortunately encountered some life-threatening complication. Cancer essentially is an immunocompromising condition. It decreases your immunity. जो भी treatment देते हैं उससे भी immunity sort of fall down होती है, and the patient becomes much more susceptible to so many opportunistic infections. So if there is some life-threatening complication which has cropped up and it is expected to say resolve, then you should go all guns in. But if the terminal condition is because of the cancer per se, it has spread a lot or it is in its terminal stage, then most of my patients they do, or our patients they do sign a DNR, that is do not resuscitate. So we do not encourage or recommend any aggressive measures in such patients. None of our patients are sent to the ICU unless it is the temporary complication that I mentioned. And uh, in fact, sometimes it is the reverse of what you mentioned. That I would be suggesting that you should let them go peacefully, but the caregivers do not want to let go. They are like कि नहीं जितना हो सकता है करो जो हो सकता है करो. So that is another it's a different topic in itself. But you need to know that what is the eventuality of your cancer. If it is something which is curable, if it is something which is treatable, you should endure that temporary hurdles or those temporary complications and just bounce back. But if it is something which is terminal, then I do not I wouldn't expect a slow painful death. I you need to know when to let go. So, yeah, I think that is what needs to be
That's
done
actually,
from a doctor and a caregiver, both point of view.
and that's actually very mentally challenging, letting
Very,
go,
yes, yes,
right?
yes, yes.
Mhm. So, how do you prepare your patients for that? Is it like a dialogue, communication, talking the technicalities? How is it?
Okay, so when any patient of advanced malignancy comes to me, I offer them palliative options from day one. So the treatment that you're doing, so it has to be a comprehensive care, and the usually it is a personalized approach. No two treatments are same. So along with the cancer directed therapy is essential, because if the side effects or if the ailments are because of the cancer itself, unless you regress it, the side effects will not go.
Hmm.
But at the same time, you do need to continue your palliative care. Palliative care is taking care of the symptoms. कि अगर पेन हो रहा है तो पेन की टैबलेट दे दी, अगर ऑक्सीजन फॉल हो रहा है तो वो दे दिया. A very important part of palliative care is pain management and even counseling. So again, I'll involve the psycho-oncology, and counseling should start from day one. ऐसा नहीं कि when you are just about to go and the you are not in that mental frame at that time to listen to what they are telling. But if you are prepared, then it is, I wouldn't say easy, but they do tend to let go at that point of time. Secondly, what you need to understand is, so many times it happens that the patient is not in a position or in a state to express their wish. So this difficult conversation also needs to be done, or it needs to be taken before you come to that point, that if you do expect that some uh, terminal event might take place, you need to know of the patient's wishes while he or she can express them. So that gives you that little courage, and that you do not feel the guilt. Majority of the caregivers or they are not able to let go because of the guilt that they couldn't do everything what the patient wants.
Yeah.
But instead of letting them suffer just for your own satisfaction, it is slightly selfish. So you can look at it from that point of view, that what would you wish if you were in that position yourself? And that is how you can probably, and at that point you are not in a state to make objective decisions. So you need to let the doctor or other members chip in and help you form a decision what to do.
Right. Right. So let's say, Dr. Prutha, that the treatment is over, everything is finished, the patient has recovered well. Have you ever witnessed the episodes of post traumatic disorder stress, like it's PTSD, right? Is
Oh,
it?
oh, yes. Oh, yes. It is just not for combat veterans. Well, PTSD usually, you associate PTSD with
Yeah, yeah,
soldiers.
yeah.
But yeah, but it is very real. It is very real when it comes to cancer. And patients have hyper vigilance, anxiety, and even in cured patients, they do have this constant fear of recurrence. when they are coming for follow-up visits, when they are completely cancer-free. There is this, I don't know, there is this expectation to, completely bounce back to normal.
Yeah.
But it is not possible. And the fear is constantly there. So, what I have seen is that uh, the treatment doesn't really stop, it just changes form. That initially the treatment were, say, in the form of chemotherapy or immunotherapy or surgery or radiation therapy. But after the cancer has gone and the ghosts are still there, you do need to take care of that as well. And uh, in certain cases, I have seen a very positive uh, uh, turn as well. Like, there is this newfound sense of hope, or this you want to just live your life to the fullest. You have witnessed the worst, and now you appreciate life more. You appreciate the relationships more. You are more grateful for each and everything that is happening. So yes, that is and that is what I would want all the patients to turn towards. So yeah, PTSD is real, and it needs to be taken care of, because no patient will come and tell you, but there are signs, and the caregivers notice, you notice. So yes, another thing is that when a cancer patient has any other illness, it is somehow just, you know connected to the cancer, but that needs to be understood by other physicians and the general public as well, that ऐसा नहीं है कि कैंसर के पेशेंट को कुछ और नहीं हो सकता है. Once they are cured of the malignancy, or once they are cancer free, they are just regular people. So not everything needs to be connected back to that particular thing. Yes,
Yeah, right. And so you said that there is always a fear of recurrence,
yes,
uh,
yes.
and there are also a few patients that I have seen. It's like that they have to take lifelong medicines so that it does not reoccur. How is the mental state of those patients? Because sometimes it's like, oh, we are tired of the medicines, and the mouth does not taste the same. I cannot eat this. I'm always tired, and I don't look the same. I don't feel the same. So, how are these thoughts healed, or how is the support given to these people who are probably going to have a lifelong treatment for cancer?
Okay. So as I mentioned that there is initial stage and the advanced stage. So majority, or I would say all the initial staged malignancies, they do have a limited amount of treatment. That is, the maximum would be, say, 5 to 10 years, not beyond that. The aggressive treatment is just for maximum of a year, not beyond a year. Whatever maintenance therapy they do need to take, those are, I would say, uh, they do not have any major side effects, or any, they do not contribute to any change in the quality of life. It is, what I tell my patients is that treat it something similar to your diabetes or something similar to your hypertension. If you are suffering from diabetes, hypertension, or any chronic illness, you need to take the medications. Just treat this as one of them, because they do not have, these are not chemo medications. Most of the maintenance therapies are hormonal therapies.
Okay.
So the hormonal tablets, they do not have any toxic side effects. The side effect profile is not zero, but it is minuscule. Like, you wouldn't really uh, uh, feel any difference in your life. The advanced malignancies, because of the sophisticated targeted medications that are now available, many stage 4 malignancies, that is terminal malignancies, are now they do have a long term survival now. So some of the stage 4 malignant patients, they are doing well beyond 5 years as well. They need to continue their medications lifelong. Lifelong, I mean that unless they are having any intolerable side effects, or unless they are having progression on the treatment. So if there is any progression, they need to change. So these treatments do have a certain level of side effects, but uh, most of my patients seem to endure those well, because the disease related complications or the disease related side effects were much worse as compared to the minor side effects that they would, and majority of it is just inconvenience, the inconvenience of taking that pill every day, or the inconvenience of undergoing regular screening tests or visiting the doctor. So it is I tell them that just treat it as a minor inconvenience rather than uh, a proper complication. So that is how it is.
Yeah, I just forgot to bring up one point. While we were
Mm-hmm.
talking to radiation and chemotherapy, you mentioned
Mm-hmm.
about one side effect, hair loss. Now,
Yes, yes.
I would want to talk a little more about
Mm-hmm.
this particular side effect, because culturally it is said that, a woman only with a long,
Yes.
beautiful, long stresses is considered to be beautiful. Um Culturally and socially also, probably there is a stress that, okay, now my hair is gone, how would I return to work, how would people see me, I don't look the same beautiful
Yes.
as I was. How would you like to address this culturally, socially? Because family members would understand, maybe people at your workplace would understand, but do we have that empathy level, at on a social basis? How is it, and how can we
Uh,
inculcate this? How can we inculcate
yes.
empathy?
So I'll discuss this in two points. One is that we are doing something about it.
Okay.
So there is research going on. Currently, you have something which is known as the scalp cooling therapy available,
Okay.
and cooling caps are available. So it essentially cools down your scalp, and it causes, I would say, constriction, vasoconstriction of the veins which are in the scalp. So the chemotherapy doesn't travel there, leading to lower side effects related to the scalp. So hair loss can be reduced to say up to 70-80%. It is expensive, but it is there. It cannot be used for all the cancers. Like you cannot use it for brain cancers or but for the commoner cancers, that is lung, breast, prostate, GI, it is used. It is not very widely available, but it is coming up, and it looks like a very promising option for somebody who, who doesn't want to, who change the way they look, or so that is one thing. Till it becomes a part of the till it becomes a till it becomes commoner, you just have to deal with it at a mental level first. You may or may not be able to generate the empathy from the population. But what you can do is the patient can have a stronger willpower. So that is what you can do, as long as the patient doesn't mind the baldness. It is more of it is something which affects you because you're letting you're getting affected by it. I know it is very difficult to not get affected, but uh, uh, the major topic of conversation in your counseling could be that. Secondly, you do need to understand that it is just temporary. So, so many patients just pass those 3 to 6 months thinking it is just temporary. Thirdly, many realistic wigs are now available, the natural hair wigs, and uh, the wigs that do not look fake. So those are available, and patients are using that quite comfortably. So that is another thing that you can do. But it will take some time. Though I think there is a lot of difference from the public point of view when it as compared to what it was initially. Like you do have a lot of empathy for cancer warriors. Uh, Children, when this is very difficult when it comes to pediatric patients
Yeah,
because स्कूल जाते हैं तो बच्चे छेड़ते हैं that
yeah,
बाल नहीं है टकला ये so that that needs to be taken care of, I think, at home as well. It is not ideal, but it is how it is. And until you can find a proper solution, you just need to deal with it the way it is.
right. I think, it is very important to understand that no two people look the same. So accepting diversity and being
Yes.
inclusive about it.
And body positivity. It is a part of body positivity as well.
Right. And this can be taught right from the beginning. I'll just chip in and mention one experience that I have had is here that the children, you mentioned about the children, right? I think in the country where I live, Germany, there is no custom of a school uniform. So children can come and wear anything while they are attending their schools. And this is because people are coming from all the backgrounds. So when you wear a uniform and go to school, you have a perception that everyone is same, and when you leave the school you think that everyone is like you, but that's not true. So they have this they inculcate this feeling of accepting other people as not being the same like you, and developing that empathy and respect for the other individual. So I think when you work with a child at the grassroots level, that person is going to be an empathetic human. This is just one
Right.
example. I don't know if we can, how far we can do this in our society, but maybe we can have some days wherein people can come in and wear whatever they want, um, maybe shave off their heads.
The another thing which you mentioned about the school. So over here, I have done it for a couple of my pediatric patients. I try to communicate with the class teacher
Hmm.
that he or she is suffering from this. So when the class teacher communicates in her way to the other kids, it makes a bigger difference than the child saying on his own, because the kids, they do tend to listen a lot and they do adore and admire the teachers. So when the teacher instructs or the teacher conveys in a certain way, they accept it better. So that is, and it has helped because the child would get depressed. The child stopped going to school out of fear of being ridiculed for the baldness. So, and after this little exercise, he was fine. So this is one thing which we can do over here in India, where
True. So Dr. Prutha, what is the role of spirituality, mindfulness, prayers, belief, faith during this entire process for the patients, for the caregivers, and for you as a doctor?
I think it is a very integral and important part of our being. Uh, Spirituality is how you perceive what works for you. So it has not got to do with religious beliefs, but it it helps you find a bigger purpose in life. When you have that purpose, you wake up every morning for that purpose. It helps you get through the day. Mindfulness, again, it helps to build your willpower and a positive outlook. So when there is positivity, I do not know the science behind it, I do not know the logic behind it, probably there is none, but it affects your course, it affects your disease course, it affects how your body responds to the treatment. and I have seen nothing but positive. So when a patient is feeling positive, he is motivated to stick to the treatment. He's motivated to complete all the he's motivated to that plan, to stick to the plan, and your body responds to it. When negativity crops in, it is your way of your body also shutting down. So I do feel that it is very important, and it should be well integrated in your uh, daily routine. So I am like big on all these extra uh, extra medical. Uh, so I do believe in a holistic approach,
Hmm.
and it is very important in a in my specialty, especially when so much is left to hope, so much is still not still unanswered. So it does play a role somewhere. It is there. That force is there. I have witnessed it myself, so it is there.
Right. Um, so my last question, the last question from my side would be: you mentioned about some resources, like some
Mhm.
online resources, some magazines, some books. I would like you to name a few magazines, or name a few books, throw in some online resources for our listeners to scan through.
Okay. So, as I mentioned, Tata Medical Hospital does have its website. Then there is something which is known as Sanjeevani. Sanjeevani website is also there. It is again an NGO based approach, and they do have online uh, mm, like online uh, resources. Thirdly, there are multiple NGOs working. So uh, we had it was my guide's initiative, TICAN. So that was for teenage cancer organization is there. Apart from these helplines available, there is iCall or there is Empower one-on-one. So those are all toll-free numbers. You can call those helplines and you can get the help that you want. Indian Cancer Society, that is ICS, it does have it has its own website and it also caters to this as well. There are many magazines available. So Cancer Cure magazine is there, and we at our own hospital. So I have also sort of collaborated, and we have our own magazine. It is a Cancer Cure magazine, which it just gives you basic pointers of what are the signs, what are the symptoms, what to expect, what is the nutritional companion of it, because a holistic approach is required. Apart from these, there are movies which can give you that sense of will. So Indian movies are there, like Anand. It's an old movie. There is a Hollywood. There are multiple Hollywood movies. The Fault in Our Stars. It's a book too. Uh, then we have. I had seen this movie, My Sister's Keeper. It is again a movie about a cancer patient and a caregiver, like their relationships. So these are certain, but the best thing is support groups, physical interaction, interacting with your doctor or your caregivers.
Right.
So as long as that is there, I don't think it should be an issue.
Right. Since we're talking about books, I would just take this opportunity to mention that I'm reading one very good book. It's called
Hmm.
Tuesdays with Maury. It's about a professor who
Hmm.
is about to die, and
Mhm.
he's not got cancer but some sort of terminal illness, and he's counting on his days. And he has been a jolly person throughout his life, and back in his days he himself has undergone a lot of suffering. But he turned out that suffering made him a very, very positive person. And now he
Mhm.
knows that he has limited days, and how he lives one day at a time and makes the best of it, and also passes on his lessons to the author of the book, who happens to be his student. It's a beautiful book, and every page
Okay.
is very meaningful. So I think I would also want to add this to the
Yes,
list
definitely.
that
It should be
you,
in the list.
right?
Yes, yeah.
It was really, really nice talking to you, Dr. Prutha. Is there anything that I have missed from my side and that you would want to add or maybe conclude?
Uh, I do think that you have included and covered every topic. I have said everything that I can or I would have wanted to, and I just want you to spread the message that cancer is curable, it is treatable. Just seek help and continue with your regular screenings or regular monitorings, because screening is something which is recommended after a certain age, and it helps you diagnose something at an earlier stage or before you can catch the pre-malignant signs. So the earlier the diagnosis, the better the prognosis. So that is one thing which you can, since you have a wider audience, I would just want to broadcast this particular message. Apart from that, uh, I think we've covered it all.
Thank you so much, Dr. Prutha. It was
Thank you
really
so much.
wonderful
Thank you.
talking to you, and many, many eye-opening pointers that you have mentioned. Thanks a lot for
Thank you
that.
so much. Thank you. Thank you.